Let us start with the important MCQ. Now, in the beginning, I will take first 5 minutes to give you the basic orientation of this session. I'll be trying my best to give you all the important topics for your upcoming INICET examination. Clear? These 20 MCQs are nothing but important topics. They are important topic for upcoming examination of INICET. But at least the 20 topics should be on your tips. Clear? So let us start with the first MCQ. A 52-year-old female suffering from thyroid carcinoma underwent total thyroidectomy while surgery. The both side recurrent laryngeal nerve got damaged. What is the expected post-operative finding? What I have done, I have twisted the MCQ. In your INICET examination, they have given you the finding. They have asked you, okay, the patient, yes, can you update in the chat box, is audio video everything fine? Is audio video everything fine? The examiner have given you the patient was having respiratory distress and which complication occurred. What I have given you, both the nerves are paralyzed. Recurrent laryngeal nerve is paralyzed. Recurrent laryngeal nerve is paralyzed. And patient will be having which symptom? So the patient will be having, yes, everybody will be having respiratory distress. Dyspnea will be there. Dyspnea will be there. Is it clear with everyone? Respiratory dyspnea. The patient will be having dyspnea. Now, what is the basic concept of this MCQ? Enjoy. It is dyspnea with normal voice. This patient will be having normal voice. Why? Because here, the vocal cord will be in the midline. Because it is recurrent nerve palsy. Both nerve will be in the midline. So patient will be having dyspnea with normal voice. Are you getting this concept? Am I understandable? Clear? If it is unilateral recurrent nerve palsy or unilateral superior laryngeal nerve palsy, patient may have change in voice. But bilateral recurrent, both side recurrent laryngeal nerve is paralyzed, it should be respiratory distress. Now, one of the student is writing respiratory distress with poor quality of voice. No, beta. In bilateral recurrent laryngeal nerve palsy, it is severe dyspnea. So, can I write? Now, listen carefully. Every student concentrate. Listen, 4 important concepts. If it is unilateral recurrent nerve palsy, if it is unilateral recurrent nerve palsy or it is unilateral superior laryngeal nerve palsy, in both the conditions, I will be getting hoarseness. I will be getting change in voice. But bilateral recurrent nerve palsy, if examiner mentioned bilateral recurrent nerve palsy, patient will have severe dyspnea. We will be going for tracheostomy. And if it is bilateral superior laryngeal nerve palsy, anybody who can write in the chat box, what will be bilateral superior laryngeal nerve palsy? It will be your aspiration. It will be aspiration with complete loss of voice, aphonia. Am I understandable? So always remember, very nice, one of the student is writing, Dr. Vashni, it is wait and watch. Unilateral condition, make a concept for Central Institute. The unilateral condition, we always go for wait and watch. Beta concept ko seekhna. Next one, learn the basic concept which is mandatory for your upcoming Central Institute. Clear? Beta audio video, everything is fine. Just concentrate. Bilateral recurrent nerve palsy, it is dyspnea. Bilateral superior laryngeal nerve palsy, it is aspiration with aphonia. Aspiration with aphonia. Done. In bilateral recurrent nerve palsy, we will go which type of tympanoplasty? Just remember, type 2 tympanoplasty. What is type 2 tympanoplasty? Lateralization procedure. So you should be confident it is lateralization procedure. Clear? And bilateral superior laryngeal nerve palsy, we do type 1 thyroplasty, that is medialization procedure. So every student, I will recommend every student should take one notebook and write all the important topic. My vocal cord palsy is the first topic. When I am preparing for INICET examination, in last spell, we will be learning vocal cord palsy. Vocal cord palsy should be my first topic. Am I understandable? So unilateral is wait and watch. Bilateral we do type 2 thyroplasty, lateralization. Thyroplasty should be on your tips. So just make a note. I am confident all the students listening to me, you must be confident of all these concepts. So make a list, beta. It is, one is vocal cord paralysis, one is your thyroplasty, type 1, type 2, type 3, type 4. All the thyroplasty should be on your tips. Then method of lateralization, method of medialization. Method of lateralization is your recurrent nerve palsy. We have to take the vocal cord away. Method of medialization is for superior laryngeal nerve palsy. This should be on your tips. Very good evening, everyone. Yes, beta, Dr. Shubhangi, very good evening. Now concentrate. Vocal cord palsy should be on your tips. Now concentrate. In your INICET, why not B? One of the student is saying, why not beta? Beta, B option, respiratory distress से better answer आपके पास आ रहा है. Respiratory distress with normal voice. So I will be going with normal voice in this segment. Option B and D both are true. Yes, if they give you multiple choice A and B, B and C, I will be going for B and D option. Done. But if I want to choose one, I'll be going for D option. Done. Is this clear? In your INICET, 60 to 70% of the MCQ will be coming from ear, and remaining will be nose and larynx. In larynx, if you want to read the topic, two topic, carcinoma larynx and vocal cord palsy should be on your tips. Examiner will ask you TNM classification of CA larynx, will ask you management. Now what I am showing you, now you tell me, I am showing you there is a tumor which is invading the thyroid cartilage. It is invading the thyroid cartilage. The tumor is coming in the neck. You people tell me, if tumor come in the neck, it involve all the neck muscles, it will be T4. So can we revise in a fast mode? If it is only one area involved, one part of larynx is involved, it is T1. If 2 or 3 areas are involved, we call it as T2. We call it as T2. I'm understandable. If tumor is going outside the larynx, I always give a mnemonic. If the tumor is outside the larynx, it is T3, like paraglottic space, like pre-epiglottic space, like pharynx, like paralysis of the vocal cord. If these words are there, perichondritis. So I am expecting one MCQ. In the last examination, they have given the tumor is going invading the neck vessels, neck muscles. Therefore, we go for T4. But if it is only involving the cartilage, now if imagination, I am just changing this MCQ. If examiner give you involvement of only cartilage, perichondritis, I will be going for T3. What is T4? T4 होता है बेटा. T4 tumor is involving trachea, tumor is involving your tongue, or it is involving your thyroid muscles, neck muscles. If we go in the favor of T4. Done. This concept is clear. So TNM classification of CA larynx should be on your tips. Very good, very nice. 5 P's should be there, 3 T's should be there. 3 T matlab T4. Done. Now management part, beta, everyone, management part should be on your tips. I'm just revising. Close your eyes, listen to my words. If examiner is giving you carcinoma in situ, carcinoma in situ की बात करेंगे तो बेटा treatment is CO2 laser. If examiner is giving you carcinoma in situ, it is CO2 laser. If the examiner is giving you T1 or T2, just remember, in T1 or T2, we always prefer radiotherapy as a first line of treatment. बेटा गलती से partial laryngectomy को टिक नहीं करना. First line of treatment is always radiotherapy. Always remember. But if the examiner asks you the treatment of choice, if examiner asks you treatment of choice, so glottic tumors may treatment of choice will be your, yes, you tell me, is radiotherapy. And all the other tumors we do partial laryngectomy. I'm expecting this MCQ. They can ask you which is the partial surgery done in supraglottic tumor. So supraglottic tumors, we are doing HPL. Very favorite question of your Central Institute. Which investigation is mandatory before HPL? Anybody who can write in the chat box which investigation is mandatory before HPL? Just remember, beta, pulmonary function test is done before HPL. Pulmonary function test should be done. Your lower respiratory tract should be normal. There is a big complication of aspiration in partial surgery. Therefore, we avoid the surgery. Therefore, first line of treatment always radiotherapy. Always pray God MCQ should be from T3 T4. Beta T3 T4 में there is no other option except we go for total laryngectomy. We go for total laryngectomy plus radiotherapy. एक क्वेश्चन आएगा. One more expected MCQ. T3 T4. T3 T4. Everybody should reply very nice, sir. The way you are responding in the chat box, excellent. It means you have revised the notes properly. T3 T4 total laryngectomy with radiotherapy. Patient deny for search. बंदा कहता है मैंने ऑपरेट ही नहीं करना, ऑपरेट ही नहीं करवाना. तो if patient is not interested for surgery, बेटा we go for concurrent chemo radiation. याद रखेंगे concurrent chemo radiation. किसमें यूज करते हैं? It is not the treatment of choice. It is only for those patients who deny for surgery. Clear? Concurrent chemo radiation. This concept should be clear. Now, CA larynx. Management of CA larynx and rehabilitation after total laryngectomy. They can show you this slide. They can ask you what I'm doing. I'm putting a tracheoesophageal prosthesis. What is the name of the prosthesis? It is a Blomsinger. What MCQ I'm showing you? Which of the following is not done after total laryngectomy? So we use tracheoesophageal fistula. Yes, we use. Esophageal voice, we do. Polite yawning, this is a new concept which was added, which they ask you in your last examination. What is polite yawning? Polite yawning, anyone who can tell me? Polite yawning is yawning with closed mouth. Why we do polite yawning? Because the patient is having no airflow in the nose. Patient have loss of nasal function. So just remember that this I am expecting. This year they may ask you polite yawning is used for. It is used for olfactory refunctioning. इस concept को build up करते हैं. Polite yawning is for olfactory refunctioning. Then supraglottic swelling, these type of exercise are for dysphagia. So option B is related with dysphagia, not to do with total laryngectomy. Again I'm repeating, vocal cord paralysis, CA larynx, management of CA larynx and rehabilitation should be on your tips. They can show you this slide. They can ask you which surgery was done in this patient. तो आप देखो बेटा, I am putting some prosthesis. So prosthesis are used after total laryngectomy. तो इस patient में हमने कौन सी सर्जरी करी है? Total laryngectomy. Again एक concept और सीखते हैं. Learn one more concept with me. In which wall of the trachea you put prosthesis? Posterior wall. Underline posterior wall. And what you will put in the anterior wall? Tracheostomy tube. Just remember beta, this is my trachea. So in the anterior wall, I will be putting tracheostomy tube. Posteriorly, we are putting your prosthesis. This is Blomsinger. अगर ऐसा कुछ दिखाएंगे, if they show you something like this, we will label it as Blomsinger. Very important topic we are learning for the Central Institute. This is FMGE voice button. I'm doing fast revision with you people so that you can manage to crack all these MCQs. So beta, CA larynx, vocal cord paralysis, rehabilitation should be on your test. These are the two important topics from your larynx segment. Study the given slide and comment where the structure drain. So what I'm showing you one slide of which sinus. You people tell me, this is which sinus? This is most posterior superior. You people tell me which is the most posterior superior sinus. Most posterior superior sinus is your sphenoid sinus. If this is a sphenoid sinus, it will drain into which meatus? Which line diagram should be on your tips, beta? Try your best to concise everything with the help of line diagram. Which important structure? In the inferior nasolacrimal duct. Which is in the superior? That is sphenoid sinus. So answer should be supreme. Answer should be supreme meatus. And in the superior meatus, we have posterior ethmoid, and in the middle meatus, क्या होता है हमारे पास? We have maxillary, frontal, anterior ethmoid, middle ethmoid. So examiner may ask you what is the other name of supreme meatus. Sphenoid sinus open in the supreme meatus. What is the other name? Out of the four options, what will be the best answer, beta? Other name of supreme meatus is sphenoethmoidal recess. For your Central Institute, what is the importance of this word? Sphenoethmoidal. What is the importance of this word? Sphenoethmoidal recess. Sphenoethmoidal air cell. Let's see who reply first. Sphenoethmoidal recess is the other name of anyone? suprematus. It is the other name of suprematus. What is sphenoethmoidal air cell? Anyone who can write in the chat box? Sphenoethmoidal air cell, a cell which is close to sphenoid but part of posterior ethmoid, is the other name for Anode cell. Is the other name for Anode cell. From here, I am taking you to the important topic of Central Institute: air cell, Anode cell, Haller cell, agar nezae, and bulla ethmoidalis. All these points should be on your tips. What is Anode? I'm confident the way you people are responding in the chat box, everybody must have revised. Anode is the most posterior cell, which is very close to which nerve? Which optic nerve? What is agar nezae? A for agar nezae, A for anterior most. It is the most anterior air cell. Most anterior air cell. What is Haller? Haller is making the floor of anterior ethmoid. And what is bulla ethmoidalis? Bulla ethmoidalis is the largest air cell. Largest air cell. I'm understanding. Only Anode is a part of posterior ethmoid. Rest all are the part of anterior ethmoid. So drainage should be on your tips. Air cell should be on your tips of your nasal cavity. Then answer will be sphenoethmoidal. Question number 5, again very important. Choose the appropriate statement regarding malignant tumor of paranasal sinus. So हम क्या कर रहे हैं बेटा? Just learn tumors of nasal cavity and paranasal. Very favorite topic of your Central Institute. Now let us crack one by one. Ogren's line extend from medial canthus to angle of mandible. Now tell me which is the important, which is a true statement. To choose a true statement. Ogren's line extend from medial canthus to angle of mandible. Batao beta, is true? Absolutely true statement. Ladderman classification. What is Ladderman classification? This is nicely formatted question. Ladderman classification is here. Two horizontal line on the roof of the maxillary, floor of the maxillary. Examiner is giving you Ladderman classification. Use horizontal line via superior, inferior orbital margins or maxillary. It is on the upper and lower part of maxillary, nothing to do with orbit. This is a false statement. If this is a false statement, again I am teaching you a nice skill. Option 2 is false statement. Therefore, I can rule out A, B, C. Try to learn the art of ruling out the option, beta. Don't run behind quantitative learning. Don't try to mug up each and everything. Nahi padh sakte beta. It's not practically possible. Even if I'm not confident of option 3, 4 and 5, I can say answer is only D. Why? Because option 2 is a false statement. Kindly thumbs up in the chat box if you're getting my message. I should rule out the option. बेटा जो multiple choices वाले questions हैं इसमें याद रखेंगे, you should always rule out the option. Make a habit of ruling out. तो option second मुझे बता रहा है examiner want कि second option को देखने के बाद you should rule out option A, B, C. Answer should be D option. I hope you are getting my point. Now, pain is the earliest clinical feature. Not at all. Not pain. बेटा pain tumors में early segment में नहीं होती. Epiphora indicate the involvement of frontonasal or nasolacrimal. Nasolacrimal. This word is making it false state. Is making it false state. देखो बेटा, smart student will get awesome rank in the Central Institute. Central Institute, it is easy to crack if I compare with the NEET. Honestly, I'm telling you, try to apply your common sense, apply to use common sense. Biopsy is unnecessary as a diagnosis is made radiologically. Not at all. We have to confirm squamous cell carcinoma on histopathic examination. So option 5 is again false statement. Clear? So this is the motive of giving this MCQ. Okay, beta, make a habit of ruling out the option. Maxillary sinus very important tumors. 2-3 फंडे याद रखो. Nasal malignancy, squamous cell carcinoma. Very good, beta. It is a late find. Pain is not early. It is a late find. Now concentrate on the board. On the screen, sorry. Malignant tumor of paranasal sinus. Most common malignancy होती है squamous cell carcinoma. ये कौन से sinus में होता है? It is in maxillary sinus. Which patient? Nickel industry. Those who are working in nickel industry. Or adenocell carcinoma. Adenocell carcinoma is in ethmoid. Which patient? those who are working in wood industry. These are the two important concepts. Again, I'm repeating for you. Squamous cell carcinoma, maxillary sinus, nickel industry, and adenoethmoid, wood industry. This should be on your tips. Maxillary sinus. Now, examiner can ask you which is the treatment for this tumor. We operate, we give radio plus chemo. Which chemotherapy is used? So a concept built up करते हैं for Central Institute. Your maxilla, your larynx and your nasopharynx. Maxilla, larynx, nasopharynx, they have a common chemotherapy of cisplatin and 5-fluorouracil. ये point याद रखेंगे. Cisplatin, 5-fluorouracil. These are the important drugs. Clear? So malignancy of paranasal sinus, very important topic. Coming to the next one, I'm taking you to the malignancy of nasal cavity. Very important MCQ. 75-year-old female present with the right sided. 75 age देखते मेरे mind में आता है. The high probability is a malignancy. Done. With right side nasal obstruction with mucopurulent nasal discharge. It is an endoscopic view I'm showing you. Malignancy of nose and PNS, one of the important topic. What is the key word in this MCQ? The key word in this MCQ is lateral wall. So which important tumors are coming from the lateral wall? If you're going for Central Institute, you should be confident which tumor is coming from inferior turbinate. Inferior turbinate is your cavernous hemangioma. Cavernous hemangioma is coming. From the lateral wall, we are having two tumors. One is inverted papilloma, one is squamous cell carcinoma. Am I understandable? Any student who can write in the chat box how you differentiate inverted papilloma from squamous cell carcinoma? Yes, both are coming from the lateral wall. Focus your eyes on the board. Both are coming from the lateral wall. Both tumor will go laterally into which sinus? Maxillary sinus. So beta, make a habit to appreciate the wall of the maxillary sinus. So what is the basic game? If the wall are damaged, it is squamous cell carcinoma. If wall are intact, if wall of maxillary sinus is damaged, it is squamous cell carcinoma. If it is intact, inverted papilloma. Anyone who can write in the chat box? What is this? This is your squamous cell carcinoma. Because wall of the maxillary sinus damage, I will make a diagnosis of squamous cell carcinoma. If the walls are intact, I will be going for inverted papilloma. I hope you're getting my point. Examiner, if they use the word septum, what is coming from the septum? Three tumors are coming from the septum. If it is whitish, it is papilloma. If it is reddish, it is capillary hemangioma. And if it is dark brown, it is malignant melanoma. Beta 6 tumors हैं जो आपके tips पे याद होने चाहिए. Cavernous hemangioma, inferior turbinate. Inverted papilloma, squamous cell carcinoma, lateral wall. And 3 tumors on the septum: papillomas, capillary hemangioma, and malignant melanoma. So this going in the favor of squamous cell carcinoma. Let us rule out the other option. Squamous cell carcinoma. Yes, right answer. Ethynoneuroblastoma. Even if you don't know anything about ethynoneuroblastoma, better have this image in your mind. If examiners show you something in the upper 1/3, capital letter, if examiners show you some tumor only in the upper 1/3, I will go in the favor of option B. Ethynoneuroblastoma. Inverted papilloma will be the right answer when the maxillary sinus is intact. I hope you are getting my point. Juvenile nasopharyngeal carcinoma. Every student, just be honest and tell me in the chat box how many students feel that option D, I am talking about angiofibroma. This is a common error in the examination. Juvenile nasopharyngeal carcinoma is not angiofibroma. Juvenile nasopharyngeal carcinoma, I am talking about malignancy. Nasopharyngeal carcinoma have bimodal distribution. One peak at 20, one peak at 60. So it is talking about 20 years patient having nasopharyngeal carcinoma. We call it as juvenile nasopharyngeal carcinoma, which will be the key word. बेटा आपके MCQ में एक word होगा unilateral cervical lymphadenopathy. I will be going for nasopharyngeal carcinoma. The examiner can ask you which triad will be seen in option D. You should be confident it is Trotter's triad. What is Trotter's triad? T for Trotter, T for 10th. Now, so if it is nasopharyngeal carcinoma, it should be Trotter. So all these points should be on your tips. Coming to the next MCQ. If OAE, one of the favorite MCQ, this is one of the best MCQ. If OAE is negative, now coming into the ear segment, after learning what are the important topics of nose, all the tumor of paralysis sinus should be on your tips. All the tumors of nasal cavity, how to differentiate one tumor from the other. What are the hallmark feature of different type of malignancy of paralysis sinus should be tips. Question number 7. If OAE negative, what is the next step? Again, one of the beautifully formatted MCQ. इसको देखते हैं बेटा. OAE negative. What is OAE? It is screening procedure. Why I'm not using it investigation of choice? Beta, enjoy this flow chart. OAE negative का मतलब होता है my cochlea is negative. Cochlea is absent. But some newborn, some cases cochlea is present but OAE absent. This can be a possibility. What is a big drawback of OAE? Why autoacoustic emission is not used as investigation of choice? We use it for treatment part and for a screening process. Slip of tongue is for screening, not for diagnosis. Why? Because it may be absent in normal cochlea. And the other drawback, it can be blocked with middle ear pathology. Beta इस concept को build up करते हैं. Build up this concept. It may be blocked by middle ear pathology. Therefore, we people never use as investigation of choice. So now you tell me if O is negative, I have to rule out कि cochlea is present or cochlea is absent. I will do electrocochleography. So I have to do option 5. If I have to do option 5, just focus your eyes on the board again. If option 5 is the right answer, I can directly jump on the D. So it should be second and fifth. Why second option? Why I am doing tympanometry? To rule out middle ear pathology. So middle ear pathology will be ruled out by impedance audiometry. And what is impedance audiometry? Is tympanometry plus tapedial reflux. I hope you're getting the concept. Revise with me. Those students who are listening to me for the first time. O is negative. 3 possibility. Cochlea negative or cochlea present but OE negative. How will rule out? So electrocochleography. Middle ear pathology, impedance audiometry. Answer second and 5. So option will be second and fifth option. Clear? This question can be repeated again. But I am making one star over this topic. This question can be there. Speech audiometry is a subjective investigation. I will not prefer pure tone audiometry, subjective investigation. What is free field audiometry? This is again a nice concept. We have free field audiometry when the sound source, we are not using microphone. Instead of microphone, we are using some other sound source to give stimulus to the patient. It is free field audiometry. We again is a subjective audiometry. So option second and D. Motive of the MCQ. Autoacoustic emission should be on your tips. Investigation of choice for conductive deafness, middle ear pathology is impedance audiometry, should be on your tips. Electrocochleography findings should be on your tips. BERA, brainstem evoked response audiometry, the whole pathway. This year the question will not be there because last they have asked you the same question twice. So auditory pathway, they can ask you important points. They will not ask the pathway, they will ask you something else. Yes, what are the important points for Central Institute? ECOLI. बेटा याद रखेंगे. 8th now is the area which is stimulated by cochlear implant. Always remember. Cochlear nucleus is the area which is stimulated by brainstem implant. They will be asking you this point. Any student who can write in the chat box. Olivary complex is the highest center for anyone. Olivary complex is the highest center for. This is the expected point. I'm just making one star over this topic. They can ask you. 8th nerve is the area which is stimulated by cochlear implant. Cochlear nucleus is the area which is stimulated by brainstem implant. Olivary complex is the highest center for tapedial reflux. These are the 3 favorite MCQs of your Central Institute. Clear? So Olivary complex, highest center, tapedial reflux. Your Central Institute people can confuse you. Which is the highest center for ipsilateral tapedial reflux? Which is the highest center for contralateral tapedial reflux? बेटा एक ही आंसर को टिक करना है. Superior olivary complex. Superior olivary complex. Done. Is this clear? So all the audiometry objective, subjective should be on your tips. Such a nice, beautiful MCQ. Tell me this one now. What is the right answer? If you can attempt this question, it means you are master of Reni's and Weber. इस question को crack करते हैं बेटा. Just try to learn. What is the right answer of this MCQ? Study the audiogram. Pure tone audiometry, Reni's, Weber should be on your tips. Let us make a diagnosis. Red color, right side. Blue color, left side. So what I am showing you. Listen. Any student who can. Yes, very good, Dr. Sunanda. Excellent. 17 decibel. सब कुछ याद किया हुआ है बेटा आपने. You have learned each and every point. Very nice. At what decibel stability reflux is seen? It is 70 decibel. Very good. ये question. Everybody should try to crack this question. I'm giving you next 45 seconds. Study the given pure tone audiogram. Comment on the best possible diagnosis. Appreciate. One red color is within 25. One red color is beyond 25. It means I am showing you a airborne gap. It means it is right side conductive deafness. Done. Blue color. One graph is within 25. One graph beyond 25. Again, airborne gap. It means left conductive deafness. So what is the diagnosis? Diagnosis of question number 8 should bilateral conductive deafness. Hardcore audiometry is there in this MCQ. Very nice. So many students are responding. It means bilateral conductive. It means which option rule out? I will rule out A and C. A or C cannot be there because Reni's cannot be positive. Reni's have to be negative. Now you tell me Reni's is negative, so Weber will be lateralized to which side? Bilateral conductive. It is lateralized to worse ear. So which is the worse ear? Which is more deaf ear? If you appreciate, more deaf ear is red color, right side. Those students who are writing option B in the chat box, hats off to your attempt. Clear? Very nicely. 3 students attempted. Yes, it is B. Again, I am repeating, beta. All these students who are listening to me first time, write the possibility of Weber, rule out one with the help of Reni's. This is the way we crack the MCQ. Now, red color graph is within 25. Red color is beyond 25. Your air conduction is beyond 25, bone conduction within 25. That is airborne gap. This is a big airborne gap. So it is conductive deafness. Right side conductive, left side conductive. Very good. It will be going to worse ear. The worse ear is more deaf ear. Thumbs up in the chat box if you get this method. First make the diagnosis. Then rule out one with the help of Reni's. In this patient, Reni's cannot be positive. I will rule out option A and C. And now Weber will be lateralized to which ear? Weber will be lateralized to worse ear. In bilateral sensory, it is lateralized to better ear. In bilateral conductive, it is lateralized to worse ear. I hope you're getting the message. Sure. Is it clear? Now, can I make one more MCQ for you? If I change this MCQ and I give you both the graph beyond 25. Now tell me, what is this one? Again, nicely formed. I am just making you master of these basic audiogram and how to crack the diagnosis. So red color, blue color, both the graph beyond 25. So diagnosis, bilateral sensorineural deafness. It means which option we can rule out? We can rule out Reni's negative. In this condition, Reni's negative out. What is left? Reni's positive. Either A or C. Bilateral sensory deafness. Reni's will be lateralized to better ear. Which is better? Less deaf. Which is less deaf? Red color 60, blue color 80. It means better is right side. It will be lateralized to right side. Reni's will be positive and lateralized to right side. I hope you are playing with the MCQ. We are playing with the MCQ. No, Dr. Neha, beta, it is not A now. It will be lateralized to better ear now. Bilateral sensory. It is lateralized to better ear. Option will be C option. Can you appreciate how nicely we are playing with these audiograms? Because our basic learning is strong. So just work hard on the basic concepts. No need of mugging up the answers. Examiner can change the MCQ anytime. He can make multiple MCQs. And this question is the whole subjective audiometry we are discussing with the help of this MCQ. Clear? Last examination, they have asked you tympanoplasty, Wolstein classification. This year, I am expecting they can ask you name of the classification. If I am keeping the graft over incus, it is type 2. We call it as Maringo-Incidopexy. What is type 3? I'm keeping over the stapes. What is the other name of type 3? Other name of type 3 is your bird-like middle ear columnar effect. Type 4 is known as minor cavum. एक छोटी सी गुफा बन गई है. Very small cave is formed. So type 4 is minor cavum. And type 5 is your round window shielding effect. So what will be the best answer? 2 is related with A. 2A. I can directly go with the D option. 1 is B. 2 is A. 3 is C. 4 is D. Clear? So right answer will be D option. Even if you know option 2, round window shielding effect, type 4. Can you appreciate in the MCQ I have given you one clue in the first option, type 5. The child who know type 5 is round window shielding effect, he can attempt the MCQ in a single go. So minimum time will be required. Time management, better please in the upcoming INICET examination maintain the time management. Time management should be the first priority. Don't waste your time. If you're stuck to one MCQ, better jump to the next one. Don't waste your extra time in one MCQ. Clear? So time management should be the priority. Coming back to the topic. Next MCQ, child with recurrent URTI, high arch palate, learning difficulty, typical history of adenoid faces, like tympanometry was done, examiner is showing you flat tympanogram, all the tympanogram should be on your tips. Clear? One of the students is writing type 1. Type 1 is not there, but I have not given type 1. In the option में नहीं है type 1 तो. डॉक्टर लक्ष्मी बेटा टाइप 1 तो हमने क्वेश्चन में दिया ही नहीं है आपको. टाइप 2, टाइप 3, टाइप 4, टाइप 5. टाइप 1 is maringoplasty where we are keeping the graft over malleus. Now consider this MCQ. It is your adenoid faces with flat tympanogram, means I am talking about serous otitis media. If it is serous otitis media, I will never go for tympanoplasty. Tympanoplasty is treatment for safe ear, not serous otitis media. So tympanoplasty is not done. Option 4. Option C ruled out. Only one. Will you do only myringotomy or myringotomy with grommet as well as adenoidectomy? The better option, the D option, I will do 1, 2 and 3. I will go for 1, 2 and 3. Option D is the best option. Clear? So this is serous otitis media. What is the treatment for serous otitis media? Myringotomy, grommet insertion. When you insert grommet, so if the patient is not responding for 3 months, I will insert a grommet. Patient not responding, I can try adenoidectomy. I feel this is clear. So management of serous otitis media, management of safe ear, unsafe ear should be on your tips. Safe ear, tympanoplasty with ossicular chain reconstruction, and management of unsafe ear is your mastectomy. All the complications should be on your tips. Which of the following are not canal wall down? Classification of mastectomy should be on your tips. You tell me. Which of the following are not canal wall down? So which are the canal wall down? Canal wall down are 3. One is radical, modified radical and aticotomy. They are canal wall down. So which are canal wall up? Combined approach tympanoplasty and Schwartz operation. So option 1 and 2 is your canal wall up. So option 1 and 2 is your canal wall up. Type of mastectomy. What are the advantage of canal wall down? Beta, you are bringing the posterior wall down. It means patient will have no reoccurrence. What is the drawback? This patient will have high risk of facial nerve palsy. Patient will be uncomfortable with the hearing aid because the mastectomy should be on your tips. Beta. All the important videos we have discussed in the lecture. How we approach from mastoid to middle ear. How we damage the posterior wall. If you damage the posterior wall, if I put a hearing aid, patient is uncomfortable. This is a very favorite concept of your central institute. After canal wall down, patient is uncomfortable with wearing the hearing aid. Is true, very true, because you have bring the posterior wall down. Patient have a high risk of infections because the middle ear communicating with the external ear. No reoccurrence. This is the advantage, but facial palsy can be there. Which is the common surgery we are doing in CSOM? That is MRM. Always remember, modified radical mastectomy is the most common surgery we are doing. All the complications should be on your tips. Management of safe, unsafe on your tips. Audiometry, subjective, objective. Very important topic for Central Institute. Clear? This question. I don't know why they have a special love for superior semicircular canal dehiscence syndrome. सबसे पहले बेसिक फंडा बेटा, even if you don't know anything, learn one point, it is conductive deafness. Done. There is a leaking of the sound. Leaking of the sound. There is a fistula in the superior semicircular canal. Let us rule out the option. Now concentrate. Superior semicircular canal is associated with all of the following except, now listen carefully, HRCT is the investigation of choice for superior semicircular canal dehiscence syndrome. Yes, it will give you site of injury. For the site, it is a investigation of choice. Tullio's phenomena can be seen. What is Tullio's phenomena? Tullio's phenomena matlab patient feeling uncomfortable in noisy surrounding. Make a concept. Tullio's phenomena is seen in sensory deafness. Yes, it is seen in superior semicircular canal dehiscence syndrome. Tullio's phenomena is there. Positive fistula test, there is a dehiscence, fistula test will be there. So this is here. Wait and watch is the treatment of choice. We always prefer wait and watch. Patient not responding, I can go for surgical repair. So wait and watch is the treatment of choice. As such, this is not a true statement. Is the first treatment, first line of treatment, is a treatment of choice, is a wrong option. Among the four options, I can go with false option is D. I will dissect this MCQ. Listen carefully. I will dissect this MCQ nicely. Wait and watch is the treatment of choice. Is the initial treatment. Patient not responding, surgical repair. Clear? Done. It is so. Now HRCT is the investigation of choice for superior semicircular canal dehiscence syndrome. If you don't get any other false statement, even this can be the false statement. Can you tell me why? Because investigation of choice is your VEMP. HRCT is for site of injury. मेरी बात को समझना है. Try to learn my concept. If you don't get any better option, I can go with option A. If they give you multiple choice option, A and D, A and D both are false statement in this. They are not true. Tullio's phenomena is there, fistula test is there, but option A and D both are partially false statement. HRCT is for site of injury. Investigation of choice is VEMP, and your central institute people will ask you what happened in VEMP. Decrease threshold. Threshold is decrease. Always remember. Threshold is decrease. Wait and watch is the first line of treatment. Mostly we use wait and watch, but its treatment of choice as such is a false statement. Option D is a false statement. A and D both are false statement in this MCQ. Clear? So this is superior semicircular canal dehiscence syndrome. VEMP is the investigation of choice. In your central institute, some MCQs, two options are right answer. So better try to attempt those MCQs very carefully. Read the option nicely and just choose the best possible answer. Coming to the next one, diabetic patient. I will not read the MCQ. I will directly go with this patient going in the favor of otitis media. More common, it is malignant otitis externa. But examiner is not asking about malignant otitis externa. He is asking you diabetic patient complaining of foul smelling scanty ear discharge. All of the following complications are seen otoscopic. There is a perforation. So this patient is not of malignant otitis externa, is going in the favor of your unsafe ear. Diabetic patient, malignant otitis externa, but the images perforation, there is a foul smelling, scanty discharge. There are the two keywords. Beta dekho dhyan se. Two keywords which are going in the favor of unsafe ear. Unsafe ear. Two important points going in the favor of unsafe ear. So delta sign, empty delta sign, gray Singer sign. These are feature of your lateral sinus thrombosis. Basalt sign, basalt abscess, battle sign. Anyone who can tell me battle sign is seen in? Battle sign will be the fracture part. If there is some fracture in the skull lower part of the segment, you can have ecchymosis on the mastoid below mastoid. That is known as battle sign. Is for fracture, is for trauma. It is not for unsafe ear. So which sign is not related? So all the important findings, but all the lateral sinus thrombophlebitis, all the important complication, all the important signs should be on your tips. Which of the following is the true sequence of auditory pathway? I pray God this MCQ should be repeated and you should attempt. That is here. This is the auditory pathway. Already we have discussed this MCQ before. Clear? Next MCQ, nicely formatted. Yes, 50-year-old patient, man with the age with tinnitus, earfulness. Earfulness. After seeing this word, keyword earfulness, my diagnosis is going in the favor of Meniere's disease. Hearing loss, right ear. 7 years later, the patient was having vertigo, progressive loss of balance. After 2-year audiometry, moderate means again sensory deafness. But examiner have given you one histopath slide. Beta, Meniere's and acoustic neuroma. Either of these two, they will ask you an MCQ. If I remove the slide, if I remove this slide, diagnosis more in the favor of Meniere's. So beta, what message I am giving you? Sensory neural deafness are very overlapping topics. So there are very few key points which help you to differentiate. I'm showing you Anthony A, B. It is vestibular schwannomas, not Meniere's. अब ध्यान से देखेंगे बेटा. Sensory neural deafness, very overlapping topic. If examiner give you fluctuating deafness, it is going in the favor of sensory, Meniere's. If examiner give you Anthony cell, examiner is giving you ice cone appearance, examiner is giving you rollover phenomena, examiner is using a word decay test, तो बेटा मैं किसको टिक कर दूंगा? I will attempt neural deafness. 4 important keywords beta: Anthony classification, ice cone appearance, rollover phenomena, decay test. If the examiner, F for fluctuating, F for, just remember, fluctuating deafness, fullness of ear, they are going in the favor of Meniere's disease. Recruitment phenomena. If examiner mention recruitment, examiner mention oversensitivity, examiner mention SI, examiner mention Turio's phenomena, they are going in the favor of sensory deafness. So these are the important keywords which should be. Sensory neural deafness, very difficult to differentiate. So these words will help you. What is the investigation of choice for sensory deafness? Sir, electrococulography. What is the investigation of choice for neural? Sir, better. So again, I'm expecting this year one MCQ on Meniere's or acoustic neuroma. Clear? Question number 16, one of the easiest MCQ, bony atresia. I will not waste my time on rest part of the MCQ. Bony atresia को देखते ही बेटा मेरे माइंड में क्या आता है? This MCQ is dedicated for BAHA, bone anchored hearing aid. Bone anchored hearing aid. The examiner is asking you most appropriate course at this time, 6 months. What is the importance of 6 months for Central Institute? By 6 months, beta. No. One of the student is writing cochlear implant. Dr. Vishwas, why we will give cochlear implant? Middle ear is normal. Presence middle ear is normal. Your cochlea is normal. Now you deleted the message. No, it is not cochlear implant. If cochlea is abnormal, there is Mondini dysplasia mentioned, I will go for cochlear implant. But in this condition, it is no. Again, age is 6 months. We can't use cochlear implant at the age of 6 months. Lowest age of using cochlear implant is 1 year. Always remember. Clear? It is 6 month old child. What is the importance of this number 6 month? By the age of 6 months, we have to treat the newborn to avoid maldevelopment of language. So my first priority is to treat the patient. I will use BAHA, bone anchored hearing aid. If the bone atresia is not there, I can use high power hearing aid, but here is a bone atresia. So BAHA, out of 4 images, which is BAHA? This one is BAHA. The option A, B, C, D. The answer will be B option. What is A? Is a implant, is an external device of implant. You should be confident. Lower age is 1 year. Below 1 year, we use hearing aid. Where you put cochlear implant? Scala tympani via round window. Just remember this point. What is the contraindication of cochlear implant? Mesial aplasia. What is the most common indication? Is Mondini dysplasia. And where you keep brainstem implant? Brainstem implant is kept in 4th ventricle. We keep in lateral recess of 4th ventricle. These are ossicular prostheses which I am showing you. PORP, total ossicular replacement prosthesis. It is used for your safe ear after tympanoplasty. And this type of prosthesis we use after stapes surgery. That is your otosclerosis. So all these basic points should be on your tips. BAHA, BAHA, bone anchored hearing aid. The right answer will be bone anchored hearing aid. 1 year, one of the student is asking what is the importance of 1 year. Importance of 1 year is the contraindication for below 1 year we should not use cochlear implant, brainstem implant because of complications. And 6 months की importance है. By the age of 6 months we have to treat the child to avoid maldevelopment of language. So answer will be B option. Question number 17. Motive of giving this MCQ. All the important landmarks should be on your tips. So in ENT we are having 3-4 important landmarks like McEwen's triangle. It is used for mastoid search. McEwen's triangle, everybody knows McEwen's triangle. This is McEwen's triangle. Temporal line, tangent. They can ask you the boundaries of McEwen's triangle. Corner septum. What is corner septum? Corner septum is a suture. Which is in the lateral wall of mastoid. It is in the lateral wall of mastoid. So it is petrospermous suture. True statement. I'm asking which is not false statement. The Central Institute people are fond of asking these hardcore anatomy. Subiculum is a bony spicule which separate the oval window and round window. Yes, it is a part of sinus tympana. A true statement. Facial recess is a surgical landmark for posterior tympanotomy. What is facial recess? Yes, we have learned in a classroom learning. This is my pyramid. What is medial to pyramid? Facial nerve. What is lateral to pyramid? Chorda tympani. This is my incus. So this area is known as facial recess, which is between incus, chorda tympani and facial nerve. Clear? It is used for opening the posterior wall of middle ear, posterior tympanotomy. Canal of tensor tympani is on the posterior wall. Not at all. This is the simplest MCQ I will say. Tensor tympani is on the anterior wall, not on the posterior wall. This is a false statement. Anatomy of middle ear should be on your tips. Beta. Center 1 MCQ expect in the upcoming examination. Done. I'm trying my best to touch all the important topics for upcoming examination. Which type of tympanogram is shown? In ET tube dysfunction. Now, examiner is telling you ET tube dysfunction. Examiner is asking you to identify the graph. This seems to be normal. A-shaped tympanogram. What is this one? This is my flat tympanogram, also known as B tympanogram. This graph is shifted from the x-axis. This graph is C tympanogram. So this is my ET tube dysfunction. This graph is seen in ET tube dysfunction. And if examiners show you this type, this is AD. Let us revise in a fast mode, or in the first slide I will explain everything. This is normal. If examiners show you this is normal. If examiners show you something like this, it is AD graph, hypermobile. If the examiners show you like this is AS. Very nice, everybody is responding in the chat box. If examiners show you something like this, it is flat tympanogram, also known as B tympanogram, flat or B tympanogram. And if the graph is shifted on the x-axis, we call it as C tympanogram. Aega question beta, 1 MCQ on tympanometry I'm expecting this year. So all the important graph should be on your tips. Done. Which investigation? Tympanometry. Tympanometry plus stapedial reflux. Tympanometry plus stapedial reflux. This combination is known as impedance audiometry, investigation of choice for conductive deafness. Impedance audiometry is a battery of investigation. Many investigations are there in your impedance, which is related with your middle ear. Done. So this is image-based MCQ again. Question number 19. Bilateral congenital sensorineural deafness. Rehabilitation by cochlear implant. Audiogram is showing profound hearing loss. No facial deformation. Long history is given to you. Examiner is telling you this. If you read, I have highlighted all these keywords bold. Why? To give you a message. Focus on the keywords in the MCQ. Cochlear implant की बात हो रही है. I am going for rehabilitation by cochlear implant, but there is a absence of inner ear. There is a aplasia, non-development of internal auditory canal. अब बताओ बेटा क्या होगा? अब बताओ what will be the right answer? This is somewhere inner ear damage, inner ear absent, not damage. It is not Mondini dysplasia. It is absent. If it is absent, which implant will be indicated? अब बताओ what will be the indication of this clinical MCQ. The CT examination is giving you absence of inner ear, absent aplasia. What is the treatment of aplasia? Aplasia key treatment. We will go to the next step. I will go for brainstem implant. Clear? And where do we put the brainstem implant? Dr. Akash, excellent. The first right answer comes lateral recess of fourth ventricle. Lateral recess of fourth ventricle. Option A. Scala tympana. No, Dr. Lakshmi, it is for cochlear implant. I will not go for cochlear implant in this MCQ because your inner ear is absent. Again, revise with me. Mondini is the indication and mesial aplasia is the contraindication. Mesial aplasia is the contraindication. Right? Which area it stimulates? Brainstem implant stimulates cochlear nucleus or it now cochlear nucleus. I have taught you in the beginning. ये question आएगा बेटा. It now is stimulated by brainstem implant, cochlear implant, cochlear nucleus by brainstem implant. Olivary complex is the highest center for your stapedial reflux. Question number 20. Question coming every alternate year. This year I am expecting they will ask you something on malignant otitis externa. Diabetic patient, severe pain, patient have facial palsy. Nice presentation of diabetic patient, facial palsy, granulation. He was found to have increased uptake of technetium-99 in diagnostic investigation. It is your malignant otitis externa. Malignant otitis externa. That technetium-99 scan is used for diagnosis. Technetium-99 scan for diagnosis. Gallium scan for prognosis. Which investigation we use in a medical college commonly? ESR. After how many weeks ESR come down? Always remember ESR come down after 2 weeks. Clear? If the ESR come down after 2 weeks, my patient is responding. Which bacteria? Pseudomonas. They can ask you Pseudomonas. Malignant otitis externa, very favorite MCQ of Central Institute. They will write the patient is having evidence of malignancy. No, it is not malignancy. It is your osteomyelitis. It is osteomyelitis of the skull base. Osteomyelitis of the skull base. M for malignant otitis externa, M for Meniere's. Which two condition of ear have medical treatment as a treatment of choice? That is your malignant otitis externa and your Meniere's. Always remember. In otosclerosis, always remember otosclerosis, we are going for surgical intervention. Stepedotomy, stapedectomy. So malignant otitis externa, we use third generation cephalosporin. But sometimes the examiner asks you which is the surgery of choice. Anyone who can write in the chat box which surgery we do in malignant otitis externa. Malignant otitis externa, we are doing debridement. Just remember it is your debridement. Clear? So these were the important topics. My motive of taking this session with you people. I tried my best to give you the 20 important topics for upcoming examination. Make a promise, beta. Whatever we have discussed in the last 1 hour, revise it properly, revise thoroughly, be confident. And make a promise, last day, 1 day before your INICET, don't touch any book, beta. Go with a relaxed mind. Your confidence, your common sense helps a lot. Try to rule out the option. It is very easy to crack these MCQs where multiple options are there. Why? Because you can rule out the option. Always follow the principle. After every option, rule out the choices. Clear? So very best of luck. Your confidence, your belief is the only one thing which will give you rank beta. So never have the feeling of guilt or regret. कोई बात नहीं बेटा. अगर एक आधा topic subject भी छूट गया, if you have missed one subject, no issue. Be confident. Go with full confidence and believe that you will definitely crack this upcoming examination. Very best of luck, beta. Good luck, and I pray that you will be coming back with massive success. And I'm confident, beta. All those students, the way you are responding in this chat box, it means you people have revised thoroughly. You have revised your basic topics thoroughly. Clear? So very best of luck for the upcoming days. Last day, don't touch any book, go with a peace of mind. Best wishes. You can ask me your queries or inbox me your queries in the Telegram group or Insta. Thanks a lot. We stop at this point.